Hi, I'm Gary White with Channel 6, Central Kentucky Television, and I'm here with Dr. Tricia Ciccone with Central Kentucky Optometric Associates, with offices in both Lebanon and Springfield. And this month we're going to talk a little about diabetes and the effect diabetes can have on your eyes. So diabetes is a health concern for pretty much the entire body if you have that, right?
Yeah, and it's one of our major health problems in our country today. More Americans are diabetic than I think probably any other country in the world. There's two different main categories of diabetes. There's a lot of, whether you're type 1 or type 2, there's kind of some overlap there in a lot of people. You say insulin dependent or non-insulin dependent. Well, there's a lot of non-insulin dependent diabetics that use insulin. So diabetes is a major health problem and endemic in this country. It seems that people younger and younger, even our kids, are becoming type 2 diabetics more readily. A lot of that has to do with our diets. Well, probably majority of it has to do with our diets and our more sedentary lifestyle that we have.
Now, type 1 is, you're born with type 1, right? That's
well, not necessarily born. Type 1 is more of what you would call a juvenile onset, but a juvenile onset insulin-dependent type diabetic where your body just does not make any insulin at all. A type 2 diabetic can start out in childhood, as we're seeing now, but it's more of an insulin resistance type of diabetic. So type 1s, really pretty much the only way you can manage them is with insulin. A type 2, you generally will manage more diet and exercise and start out with oral hypoglycemics. There are some injectable hypoglycemics that they're using now.
Okay.
And then some of those folks actually even end up on insulin also.
Okay.
So that's kind of how they get differentiated as far as how you start treating them. Type 1 diabetes is generally more of an autoimmune disorder where your immune system just attacks your pancreas and your islets of Langerhans and destroys your body's ability to produce insulin.
Okay.
Whereas type 2 diabetics, it's something that builds up over time due to lack of exercise, increased carbohydrates and sugars in your diet, and there are some genetic components also that can play a factor in developing of type 2 diabetics also.
Okay. So, but either can eventually affect your eyes, correct?
Sometimes one of the first places someone who's just becoming a diabetic is seen is actually in the eye doctor's office, because when your blood sugars shoot way up, you have an increased myopia, hyperopia, and you have blurred vision. So sometimes I'll see somebody and I'll see a big change in their refraction over a short period of time, and first thing we'll do is go get a check for diabetes, and more times than not we end up with a positive diagnosis there. So that's one of the first things that can happen with diabetes. Diabetics also have a higher incidence of cataract formation and a higher incidence of glaucoma. But the most devastating eye problem or vision problem with diabetes has to do with the microvascular disease that increased hemoglobin A1Cs, increased glucose levels cause. And the thing is that the end stage or the advanced end vascular and end organ damage that occurs in your eyes, generally, if it's happening in your eyes, it's happening elsewhere also, and that's another something to stress, is when you have diabetic eye disease that I can look in and see in your eyes, it's already well beyond where we want it to be. It happens before we can even see it, and we're coming up with new diagnostic instruments that can really help us detect it earlier with these new OCTs that have angiography associated with them. But it's microvascular damage. The tissue itself get starved for oxygen. That's where that's where it starts. You got too much glucose circulating around in your body, and the glucose jump on to the hemoglobin, and the hemoglobin, if there's a glucose on it, it can't carry an oxygen. So that's why that A1C number is so important, and that really tells you what's happening with a diabetic. So if your blood is percolating all over your body and it's going to your feet and to your kidneys and to your heart and to your brain and to your eyes, and if there's too many glucose on your hemoglobin and not enough oxygen, the tissue needs oxygen. The tissue starts to show stress and die because, or under stress, or die off, or show damage because the tissue is not receiving enough oxygen. And that's kind of where it all starts. Then the blood vessels themselves start to get leaky because they're trying really hard to deliver enough oxygen to all these tissues that are sending signals saying, you know, we need more oxygen.
Yeah.
And so what happens is the blood vessels start to get leaky, and they start to leak and cause damage. And this can happen in your kidneys, it can happen in your heart, and it happens in your eyes. And when it happens in your eyes, then your eye tissue starts to produce this protein. It's called VEGF, and the VEGF is a protein that says, okay, we need more blood vessels in this retina because we're not getting enough oxygen to this retina. So you start to develop these vasoproliferative new blood vessels, and these blood vessels aren't like the ones you were born with. They're not good, they're low quality, they just don't deliver, they cause a lot of bleeding and a lot of breaking, and they cause all kinds of havoc inside your eye. And when these start growing, you know you're in trouble. So, and that can cause vitreal hemorrhages and retinal detachments and macular edema and all those sequelae of things that can cause you to lose your vision. And generally, if it's happening in your eyes, you probably have some kidney problems going on too, and you better get your heart checked out. Because it just doesn't happen in one organ, and it's generally happening elsewhere. So the biggest preventative thing a diabetic can do is you got to eat a high protein, low carbohydrate, low fat diet. You got to take your medication, and you got to control that A1C, the hemoglobin A1C. And I don't know how many times a day I ask folks, you know, what's your A1C? Well, I don't know. That's a number every diabetic should know. They should know when they had it done last and what their number was. You want that percentage, because what it is that it tells you what your average, how many percentage, or what the percentage of your average hemoglobins, how many had a glucose on them instead of oxygen on them. And that's what that number tells you. The higher that number, the more trouble you're going to be in. The lower that number, you're better off. Ideally, if you could get it to a non-diabetic state, which would be under 6, that would be like perfect. But realistically, that's not. If you can keep that number between 6 and 7, you're doing a pretty good job of controlling your diabetes. Every diabetic should know that number. They should know when they had it last, how often they have it, and usually, depending on your situation, most brittle or poorly controlled diabetics are going to do that number every 3 months. Some diabetics that are real mild, that are in really good control, might do it every 6 months. Just about everybody needs it done more than once a year, but it tells you what that average is over a 3-month period. So it gives you a better idea of how you're controlling it than whether or not, you know, when you just go for a finger prick and get what your actual, you just are measuring what it is at that moment. You know, so it doesn't really give you an idea of long-term control. But diabetic retinopathy is one of the leading causes of vision loss in Americans today, and really across the globe. So you just need to exercise, do the best that you can with that diet. High protein, low carbs, no sugars, no Mountain Dews, and exercise. Just get out there, and you don't have to, you know, go run a marathon, but just get out there and move and walk and move.
Yeah. And so when somebody comes in for an appointment, that you do look to make
Yeah,
sure.
every patient, every time. Whether you're 10 years old or 50 years old or 80 or 90 years old, you're going to get a dilated fundus examination. And that's, that doesn't always tell us, if you don't have anything going on, it doesn't always tell us that you're not diabetic, but it will help us, and sometimes it will help us identify who is, and also it will help us to determine, if you're at risk for vision loss. So every diabetic should have a dilated fundus exam once a year, no matter what, even if you feel like you're seeing fine, even if you think you're in the best control that you can be. One of the first questions that my staff is trained when they see that you have diabetes, first thing they're going to ask you is what your A1C is. So if you have it scheduled, go ahead and call your physician and make sure you know what that number was, and communicate that with us, because that tells me too how often I need to see you. If your A1C is up over 10, I'm going to see you in 3 months. If your A1C is 6.1, I'm probably not going to see you for a year if you don't have anything going on. So it's important to know what that number is. But diabetic retinopathy is, if you're diabetic, the longer you're diabetic, the more you're going to be at risk for these sequelae to occur. But generally, the better control you have of your diabetes, the lower the risk you have for these eye complications and other organ system complications from interfering with your quality of life and increasing your longevity of life.
Great. Again, I've been talking with Dr. Trish Ciccone with Central Kentucky Optometric Associates with offices in both Lebanon and Springfield. And if you need to schedule an appointment, you can give them a call. And the phone number here in Lebanon?
270-692-1871. Springfield is 859-336-9388.
Great. So call Central Kentucky Optometric Associates and get scheduled today. This has been Gary White for Channel 6, Central Kentucky Television.